Thank you. My name is Dr. Diana Wooler. I am a resident family physician at the Brown Family Medicine Program, and I care for patients who mostly live in Pawtucket, Central Falls, and Providence. I'm also an abortion provider. I want to tell the story of one of my patients. She's 20 years old. She had had an unplanned pregnancy, carried the pregnancy to term, and had a beautiful baby girl. I saw her at a postpartum follow-up, and she had this gorgeous baby. She was struggling. She was trying to put herself through CNA school. She was not married, but she wanted to give this baby the best possible life that she could. I asked her when her last menstrual period was, and she says, well, I actually haven't had one since the baby was born. But I just had a baby, so there's no way I could be pregnant. The baby was 4 months old, and she was 6 weeks pregnant. She was already very much struggling to support this child, put herself through school. It would be darn near impossible to do so with 2 children under the age of 1. Thankfully, I have the training and the faculty support. We did an ultrasound in the office, got the proper dating. We were able to call Planned Parenthood and make her an appointment that day to get an abortion. And now she's about to graduate from CNA school, and she has a much better chance of being able to pull her family out of poverty. The vast majority of the patients I take care of are Medicaid eligible, are on neighborhood health, are lower income. We know that women in poverty are disproportionately affected by unplanned pregnancies. And we know that if the option for an abortion were not to be an option for these patients, wealthier patients would be able to go to states where they're able to have these procedures. Women who can't take the time off of work, who can't afford the bus ride, who can't afford the procedures, it's going to create greater inequity than there already is. It's going to be really tough for these women. We know that the vast majority of women state financial straits as a reason they're getting an abortion, that they couldn't provide for that child or their other existing children. I'm a family physician, which means I'm a primary care doctor and an expert in how to keep families healthy and thriving, women and their families. And having abortion as well as contraception is a really important part of that. Thank you, Madam Chairwoman and the Judiciary Committee for staying so long, and thank you to everyone for your time and for respectfully listening to all of our stories.